More concerns are being raised about the well-being of the homeless in Toronto.
Street support workers say there has been an alarming number of overdoses and shelter conditions are not safe. CTV's Janice Golding is standing by live with more on that. Janice.
Michelle, as they do every month here at the Church of the Holy Trinity, they are holding a memorial service this noon hour for those homeless people who have died on Toronto's streets. And today they're sounding the alarm on two counts. Firstly, they say that there has been a number of overdoses occurring during the ongoing cold weather. And secondly, the increase in deaths of homeless people. Now, the Moss Park Overdose Prevention Site says that between August 2nd, 2017 and January 5th of this year, it had nearly 4,000 visitors and it managed to stop or reverse 143 overdoses. In the last 2 weeks alone, they've seen a spike, however, with 356 visits, and they managed to reverse 14 overdoses. Organizers here say many of those who are accessing the OPS are homeless and can't find adequate shelter, so they're using the site to warm up. Some of those gathered here today claim shelters in the city are unsafe and unsanitary, and they're calling on the city to increase shelter capacity by 1,000 beds by April the 15th. They're also calling on Toronto Public Health to release the data on the number of homeless deaths which are directly attributable to overdoses.
We've been calling shelter intake 311, calling different services to try to get shelter for our folks, and there hasn't been any shelter. And so it's really, especially dangerous for people who are using drugs, who are perhaps more vulnerable, going out into the cold. They're more susceptible to frostbite when they don't have any place to live. We know that several of them are staying in the warming shelters, but others are choosing to sleep rough because of the conditions in the shelters. And so that's really problematic because it really defeats our aim of trying to prevent overdose deaths if they're dying elsewhere.
Following the memorial here, there will be a media avail with the key players, so we'll have an update for you a little later in our newscast. Reporting live, I'm Janice Golding. Now back to Ken and Michelle.
Thank you, Janice.
We have more now on growing concerns about the city's homeless and their safety. A memorial service is underway this hour where advocates say what's currently being done isn't enough. CTV's Janice Golding joins us now live with an update. Janice.
Government simultaneously. I'm also a six-time mayoral candidate, and to listen to the crackerjacks.
Hi, Michelle. We're live right outside the Church of the Holy Trinity right now, where the memorial service has just concluded. I can tell you that there are a number of people here who are very concerned about the situation on the streets right now. They read out 4 names of people who have lost their lives living on the streets, 2 men and 2 women, and they say that they are concerned because shelters are over capacity at present. They say that people are having a very difficult time finding beds, and beyond that, they say they don't feel safe inside these shelters. They also say that the number of people visiting the Moss Park Overdose Prevention Site has spiked over the last 2 weeks, and they believe that's because people are avoiding the shelters and using the Moss Park site as a warming center. They say this is untenable and it cannot continue. Here's what John Clarke from OCAP has to say.
What it really comes down to is we've, yet again this year, been in a situation where the provision for people's basic shelter needs has not been there. And belatedly and reluctantly, they've scrambled to provide additional space. But you've got hundreds of people in an overflow system that doesn't meet basic shelter standards and doesn't preserve people's safety, health and dignity. So what is required is for this city to create 1,000 new shelter beds.
So John Clarke is asking for 1,000 additional shelter beds in our city shelters by April the 15th. Reporting live, I'm Janice Golding. Now back to Michelle.